So please introduce yourself and your organization a little bit.
Hello, I'm Tony Hall. I'm the Chief Procurement Officer for the University of Missouri System, which encompasses 4 campuses, 7 hospitals, 400 physicians, 28,000 employees, and about $1 billion in spend.
So are you busy, okay? Kind of busy a little bit?
Well, there's degrees of busy. I think that a little bit of what people don't often understand about our organization is because we have a large health system as part of our organization. Most universities don't have academic medical centers. We have an element of our business which represents about 1/3 of our activities. That's 24/7, 365.
Wow.
Now, while everybody admits or claims that they work 7 days a week, in healthcare you do work 7 days a week, and that goes top to bottom.
Tell us a little bit about, under your leadership, how you've transformed procurement at the University of Missouri, as well as what you've done leveraging Zycus tools that has enabled you to make the strides that you've made.
I think one of the things that we focused on was, that I focused my career on, is surrounding myself with good people. And having a proclivity to look out forward as what's happening within the industries that I'm involved in. I spent most of my career in healthcare. So 5 years ago I entered the university setting, and it's a different model. And 1 year into that relationship, I became the Chief Procurement Officer. So I was propelled into a position for which right place, right time, inadequate experience. So you have to focus on team, number one. You have to be prepared as a leader to bring leadership development tools to that team where you're lacking in experience or efficacy as to what's going on. And then you have to look out forward as to what you think is going to happen in these industries. And then you have to look internally. So that was the first thing we did. And the first thing I noticed was that we really had 2 disparate organizations. We had the health system team, procurement team. We had the university team. It didn't make sense to me to have that duplicity. Now, while they are different, widely different, if you look at the health system, it's a cradle-to-grave relationship. It's a 24/7 operation, and universities are typically pure procurement organizations where we do negotiations, contracts, we back out, and most of the activity beyond that, we don't have the rest of the supply chain. We don't do distribution. We don't do patient charges. We're not in the revenue field, as it were.
Right.
I looked at that and said, it doesn't make a lot of sense. Let's marry these 2 together. So we developed an MOU, a memo of understanding. And this is kind of a long story, but we'll get to the point. We married those 2 organizations in 2009. And then the challenge was to make them work together because they are 2 completely different models. So we, in 2011, completed that mission, and we're in a full shared service environment now. The glue that holds that organization together is our operations team, and this is where Zycus comes into the picture. Zycus is one of a suite of tools that we use, but a primary tool at this point for data analytics, which is our primary use of that tool. And that was new thinking to the university. It wasn't new thinking to the health system, but the health system didn't have a tool, so we used other organizations to try to mine for information. And we weren't very successful with it, quite frankly. So the structure that we put into place included a position called a client relation manager, and their job is to drive contract compliance. And the success of the university team is based on contract compliance, because the more compliant we are, the better long-term we are financially. And with healthcare reform impacting the organization, as well as declining funding from the state, it's very important that they meet and exceed their savings objectives annually. And that's a tool that we've used to dig down to the offenders, as it were, at the user level and have discussions around why it makes sense, if nothing else from a process cost perspective, to do things within the systems which we have, and I hate to use the term mandate, but the systems that we're really mandated or obligated to use, and those working outside those systems. Zycus has been a tool that's helped us change the penetration, as it were, of compliance from something in the 50–60% range to now approaching 80, with a goal of 95 long term in 5 years.
So it would be fair to say that the Zycus tools have been instrumental into the transformation that you've been able to bring about in efficiencies and just streamlining processes within your procurement organization, as well as marrying the organizations together from an operational standpoint and getting the data that you need.
That is a correct statement. The short answer is yes. The long answer is it was long overdue, and something that the university system embraced and the health system has struggled with. So my challenge to Zycus moving forward is that we have other types of information for which we need to pull in. And I'm looking at the new tools that exist today, and I'm quite excited about those that we are not using actively and potentially pursuing those. But my challenge is on the healthcare. They're going to work wonderfully for the university setting. My challenge on the healthcare side is we have other systems from which we need to pull data around physician utilization and the expenses associated with procedures and revenue streams. And I think those are doable. And those are things that I think we'd love to work with Zycus on developing long term. Because I think our success as a health system with healthcare reform, we're doing a presentation here in a few minutes about the impact on our organization alone. We typically make about $30 million a year, when all in the balance sheet. In FY16, we project being $100 million upside down, having changed nothing but introducing healthcare reform. So our objective from a supply chain is to get somewhere between 25 and 40 million of that by FY16. With the tools we have available to us currently today, we can only identify about 18 million. So we're looking for growing our relationship with the partners that we have that can provide us the tools that we need to get to that other 7 to 10 or 15 million dollars that we don't enjoy access to today, without trying to develop that internally, which is extraordinarily hard to do in these times from a staffing and project planning perspective.
So it sounds like you're confident Zycus is going to be able to rise to the challenge. So when you took the helm of the ship as the CPO at University of Missouri several years ago, what made Zycus stand out? What led you to select Zycus over all the other competitors? I'm sure you looked at all the solutions and you had to make a decision and say, we're going to go with these guys. What made that choice for you?
Well, interestingly, when I received the position, they were in discussions and negotiations with Zycus at the time, and my challenge to them was very specific. I gave them a bulleted list of things that I knew I was lacking in my history from a healthcare perspective, and said, how close can you come to this? And then I challenged the team as to why Zycus was their choice at that time. And it was clear to me that while the data mining aspect and reporting was something that a lot of people could provide, it was the long-term vision that we could feel. We had that feel and became quickly convinced that that vision was really the differentiating factor between Zycus and the other people that they were entertaining at the time. So we moved that forward, and then it was just an issue of finding the money and moving forward with the deal, which we've just recently renewed, by the way.
So we're thrilled with your partnership. It's tremendous to have you and your staff here at the Horizon event. Thank you so much for joining us. We look forward to seeing you next year in Florida.
And thank you for the recognition.
Thank you.